Hello, my name is Dr. Robert Findling. I'm the Director of the Division of Child and Adolescent Psychiatry at University Hospital's Case Medical Center, and I'm a Professor of Psychiatry and Pediatrics at Case Western Reserve University. Now, in a prior posting, I spoke about the challenges associated with accurately diagnosing schizophrenia in adolescents and children. Now, today, in this posting, I'll be talking a bit about means by which accurate diagnosis of schizophrenia may be facilitated. Now, when faced with a youngster for whom a diagnosis of schizophrenia may be considered, there are four key areas of the patient history upon which I have found really it helpful to focus upon. Now, first, it's important to remember that schizophrenia is a psychotic illness. Therefore, if a youngster is indeed suffering from schizophrenia, they should be suffering from the psychotic syndrome. Now remember, psychosis is not a symptom, but it's in fact characterized by positive symptoms, negative symptoms, as well as symptoms of disorganization. So therefore, a person should really try to differentiate whether a youngster is suffering from a psychotic symptom, whether or not this psychotic symptom is actually occurring within the context of the syndrome of psychosis. So that's the first one. Now we also know that heritability is a key factor for the development of schizophrenia. So therefore, examining whether or not the youngster in question is at genetic high risk for developing schizophrenia is another and the second important aspect of the patient's history. Now for that reason, performing a meticulous family history, and I mean meticulous, can be quite helpful during a diagnostic evaluation. Things you want to ask for are things like, do other family members suffer from schizophrenia? Are there other family members who have idiosyncratic thoughts or beliefs or behaviors that might lead the evaluator to suspect that a patient's family members might be suffering from a cluster A personality disorder? Similarly, are there other family members that are highly avoidant of others? Now, another key aspect of the history is really thinking about the longitudinal course of the youngster's difficulties. We know that schizophrenia is associated with a longitudinal course that's often associated with premorbid dysfunction, as well as a prodrome that antecedes the development of psychosis. So, a careful exploration of the patient's longitudinal course that focuses on developmental history, as well as premorbid social functioning, can be oftentimes quite helpful. Now finally, schizophrenia is a pervasive condition. Therefore, it's important to explore whether or not the symptoms of psychosis from which a youngster is suffering are in fact prominent and pervasive. For example, are the symptoms of psychosis present in different settings? Are the symptoms of psychosis or psychotic symptoms manifest throughout the course of the day? These are the kind of things one wants to think about when taking a history of a youngster for whom a diagnosis of schizophrenia is being considered. So in short, by taking a meticulous history that focuses on the presence or absence of the whole syndrome of psychosis, not just psychotic symptoms, a thorough family history, a careful developmental and longitudinal history, as well as a really well-considered exploration about the pervasiveness of the symptoms that are described to the evaluator can all be useful in helping the clinician examine whether or not a patient that presents with a possible psychotic illness truly does or does not suffer from schizophrenia. In a future blog, I'll review new treatment research that's now available regarding the pharmacological therapy of schizophrenia. Now, please feel free to comment on what I've talked about today by clicking on the Discuss button, and that's the link button located beneath this video screen. I'm Dr. Robert Findling. Thank you for watching.